Welcome back for 2026, for our first episode of the year. Before we get into today's episode and we introduce everybody and introduce the episode, I'd like to remind everybody of the normal housekeeping items. So if you're internal watching this for Montgomery County Fire Rescue and you need COPDI credit, please make sure you follow the form on the Training Academy website. Again, as Chief Light put out earlier, it is the 2025 form. He will migrate that to the 2026 hours when the new form gets up and running. If you guys have, it's scheduled for 90 minutes. If you guys have any questions as you go along, we'll be monitoring the chat here. So please put your questions in the chat and we'll get to them as we can. We'll cover if you have any lingering questions here at the end. So for those who are watching from the outside, and I'll introduce some outside people we have on with us today outside of Montgomery County Fire Rescue. But my name is Matt Machala. I'm a captain currently assigned to the Office of the Fire Chief under the Safety, Health, and Wellness section as one of our safety officers here in Montgomery County. And I'll be moderating today's episode of Challenges in the Streets. So as stated, today's episode is about cancer. We're going to talk about cancer specifically related to cancer in the fire service. We chose this date and this time for this episode because January is National Firefighter Cancer Awareness Month. So we brought in some esteemed outside guests, which we'll introduce here shortly. At this point in the episode, Chief Smedley was going to deliver some opening remarks. Unfortunately, some scheduling got changed with his travel, so he's unable to be here in person to deliver the opening remarks, but he did want to deliver a couple things. So I'm not going to try to speak for him, but I just want to cover some things that I know are important to Chief Smedley and the organization. So first of all, again, like I said, we have outside guests, so we really want to thank everybody for their time and joining us here today. That's number one. So again, 90-minute episode. Normally I would turn it over to the chief here, but he wanted to convey just a couple things. So member health and wellness remains his top priority as an organizational priority. So one of the things here today, we are a learning organization. Okay, we know we have policies and procedures in place. We've talked about best practices, but because we're a learning organization, and we brought in a lot of outside expertise here today just to deliver some facts to us, some additional information, and hopefully incorporate that into our personal and organizational practices. Some excellent things we're doing organizationally already as far as hopefully cancer prevention, early detection. We're going to keep doing all those things. We're going to talk a little bit about these items as we go along, but our post-fire decontamination procedures, our initiatives like Wash Your Hood Sundays, we're blessed to have 2 full sets of gear for all our members, ready access to gear cleaning, all those great preventative measures, the union's efforts and others to get outside cancer screening completed and reimbursement, all the efforts that have gone into those items over the years. Our annual physical program through FROMS, all those things we're already doing are great. But again, we're trying to learn and we're trying to improve as an organization and personally, so that's one of the reasons why we're here today. We acknowledge we still have work to do, and hopefully we're going to take some of these outside ideas and information and incorporate that to our daily practices. So just a personal note from me, obviously we know we have a lot of policies and procedures in place as far as cancer prevention measures. We're doing things here at the Training Academy, if you don't know, as far as our new recruits. We're teaching them new ways to don and doff their PPE to minimize their exposure, really emphasizing decon when we come out of burns and things like that. So we're really starting to get people from the beginning to do these things correctly and have better practices than we did in the past. But all these things can't happen without personal accountability. So while we have policies and procedures in place and people have opinions about what we should and should not be doing, a lot of this is about personal accountability and responsibility. So taking these things seriously and learning and being better than we were before. Before we get into the intros, I would like to acknowledge that we have the EPH 643 Occupational Health class, which is a graduate level public safety, a public health course from the University of Miami viewing today, and you'll understand why when we introduce our panel. But that course is a mix of master's and PhD, public health and environmental health students, so they're joining us from down in Miami, so I'd like to thank them for being on and joining us and watching with us. Before we get into the intros, the one last thing I have, we do have a video that was pre-recorded. One of our members sharing their personal cancer story. I personally had not heard this story. I know this person, but I was not aware of what they went through. I viewed it for the first time last night, and I think it's super impactful. So we're going to play that for you guys here today, right now. So we view that as a group, then we'll get back into our introductions.
So I turned 49 in May of 2023. At that point, I thought to myself, I said, you know what? I just told myself, fit at 50, I said to myself. And so I went to the doctors. I would get physicals done outside of here. Went to a doctor then, and that doctor said, you know, you should probably go get a colonoscopy. And so I literally had that appointment when I turned 49, May 13th of 23. I was diagnosed with stage 4 cancer the first week of June. So I guess I made it 3 weeks into my Fit at 50 quest. Went in for a routine colonoscopy, was getting dressed out of that, getting ready to leave. The nurse didn't say anything to me about how the procedure went. I had my clothes on, and I walked out of the room, and the nurse said, the doctor's going to see you in the conference room. I said, I know that's not good. So I went in the conference room, sat down, and she had a booklet already stapled together, colored pictures, and she said that I'm real sorry to tell you, you have cancer. I said, what? And so there was like this, I saw pictures of like this, I think it was like a 7-centimeter tumor. I was, this doesn't even seem right. I felt fine. I said, this has got to be a mistake. This is not me. So I was whisked from that into a CT scan within an hour. So they did a CT, and then the CT actually came back and they said there was no, it was just in a bunch of lymph nodes, and then obviously the tumor. So it was stage 3. I learned, I think 2 weeks after that, I was stage 4. And the difference between the two is, for me, rather than have radiation first and then systemic chemo second, they flipped it. So I had systemic chemo because obviously stage 4 is metastasized to my liver. So I went through I think it was 12 weeks of chemo starting in June, late June of 23 through October, and that was misery. Immediately after that, I went through chemo radiation, which is chemo pills and then radiation. I went through, I think I had 4 second-degree burns out of that. That was misery too. But, you know, as I learned, things were improving and things were doing very well. I learned later. After that, that finished me out through 23, and then in 24, they went ahead and did a liver surgery on me, where they went through and to basically cut away at the pieces where there was cancer. And I think that was like a 10-hour surgery, if I remember. But all of this, you know, ended up, for me, it was as good an ending as you can have. I mean, I'm here today to talk about it, which is the point of today. You know, from a 14% chance to live to sitting here in front of these guys that I love to talk about this and tell the story, in hopes that other people understand how important it is to get checks, how important these scans that come out, these emails or these Facebook posts that you see that say go do these checks, they're so important. It doesn't go away just because you don't know about it. I promise you that. What I was told with my cancer was that it was the doctor said I probably had it for 10 years. So I was diagnosed at 49 years old, which would mean I had it at 39 years old, which is way before we're doing a lot of these colonoscopies and even some of these screenings. So the fact that we have the ability to go do these screenings, take advantage of that. In the workforce, on the street, keep your gear clean. The wash your hood on Sunday thing is not just a joke. It's not just, you know, wash it, clean it, send your stuff out. I have noticed how fast we actually get our gear back now. And they're cleaning. Send your boots out, send everything out. I think one of the things that we never think about is the liners in your helmets, all of those things, clean those things. It matters. I don't want to see people going through what I went through. And because that was miserable. And that'd be my mission, or my message at least. So it's something I don't want to see anybody go through.
So I'd like to personally thank Captain Talley for sharing his story. Again, I found it personally super impactful, and I think it's very important that that message gets spread to everybody in the organization. So thank you again for sharing that with everybody. At this point, I'm going to start to introduce our panel. So across the table from me live in the studio, we have Captain Garrett Cummins, who's assigned to our Fire Rescue Employee Medical section. And I'm going to turn it over to him and let him explain a little bit more about what he does to the members of our panel and everybody else watching. And then he's going to introduce the remaining members we have here with us. So, Captain.
So thanks, Matt. So basically at FROMS, when someone gets injured or diagnosed with cancer, they get assigned to me. So I get the phone calls. And, to put it in context for us, we've had 46 people diagnosed with cancer in the last 42 months. And currently we have 8 people off getting treated. So I'm kind of their interface. And really we started trying to look at doing more for people as our caseload has increased over the past couple of years. So, I'm kind of privileged to walk with them and deal with them and see Doug and what he went through and other people. So, I'm trying to really go out and bring in these other people to help us get ahead of this. If there's something we can do, let's do everything possible to cut down on the number of these cases. So that's kind of what I'm doing. And I do want to mention, because this is something, it's really personal to us. And in the last, year and a half, 18 months, we lost Master Firefighter Will Wu, Battalion Chief Pat Stanton, and Firefighter Chris Kendall to cancer. So we just want to remember those guys and do everything we can to avoid any in the future. So to my left today is Steve Weissman. He is a 46-year veteran of the fire service. He is currently the Eastern Regional Director of the Firefighter Cancer Support Network. He retired as a deputy chief in Stafford County, Virginia. He also worked in Fairfax, where he retired as a captain. So he's very active in Firefighter Cancer Support Network, and we're going to hear a lot from him. A lot of good just street-level information from us. I've heard him speak multiple times. He does a great job. In Miami today, that's where they're coming in remotely from the University of Miami and the Sylvester Comprehensive Cancer Center. We have Dr. Alberto Caban-Martinez, who's the Deputy Director, and he is a professor tenured of public health and in Division of Environmental and Public Health of the Department of Public Health Sciences at the University of Miami School of Medicine. He's the Director of the Musculoskeletal Disorders and Occupational Health Lab and the Associate Director of the Miami Occupational Research Group. And then we have Dr. Natasha Schaefer Solle, who's also the Deputy Director and Investigator of Sylvester Comprehensive Cancer Center. She's a Research Associate Professor at the University of Miami. She earned a BSN and PhD in nursing from the University of Miami. And she deals with research in disparities in occupational health and cancer prevention. So we welcome you guys very much. Thank you guys for taking the time to be with us.
Yeah, so thank you. Also, I want to echo that too. If we want to start, just kind of allow everyone to kind of explain a little bit more in depth maybe about what their role is and what they do. So Steve is here in the studio. So if you don't mind, Steve, do you want to just give another quick synopsis of kind of your role and what you do at the Firefighter Cancer Support Network, and then we'll get to the folks in Miami?
Yeah, absolutely. Thank you for having me here today. Appreciate it. The captain read my resume of my career. There's one area he left off, which I'm more proud of than anything, is that I'm a cancer survivor. 9 years ago, I was diagnosed with cancer, and it was through early detection found my cancer. At that point, I had nowhere to turn. I had nobody to look for assistance. So I found out about the Firefighter Cancer Support Network. I reached out to them for assistance. They supported me through my fight, my battle of my cancer. They also supported my family, which I'm internally grateful for. I saw their mission, read their mission, and I joined up to be part of that mission. And through the time, I was the Virginia State Director, which I still hold that position, but I'm also the Regional Director for the Firefighter Cancer Support Network, and I cover all the states east of the Mississippi. And that's our mission. Our mission is to support firefighters and their family members when they're diagnosed with cancer. And that's something that we are very proud of. We go across the nation. We have chapters right now that work with folks in Canada to bring the service to firefighters up north.
Awesome. Well, thank you very much for what you and your organization has done and continues to do as far as education, support, and everything there. We go to our doctors joining us in Miami. Would you guys like to just explain a little bit more about what you and the Sylvester Comprehensive Cancer Institute is doing as far as firefighter cancer research and education?
Yeah, absolutely, Captain. Thank you for having us in our class with you today to have this really important conversation about cancer control and prevention in the fire service. We live and breathe this every day here at the University of Miami and at Sylvester. Sylvester is what's called a National Cancer Institute designated center, which means we have the backing and the support of the NIH in how we think about cancer prevention and control. Over the last 10 years here at the University of Miami, we've developed what's called the Sylvester Firefighter Cancer Initiative. It's an initiative that's focused directly on firefighter education, research, service, and screening for cancer for all firefighters, not just our Florida firefighters, but everywhere around the country. I get to serve and have the privilege of being the deputy director for the FCI. I focus a lot on biomonitoring and how we understand what carcinogens firefighters are exposed to in the workplace and how that translates into cancer and how we can prevent that. I'm going to pass it over to my better and smarter half, Dr. Natasha Schaefer. She'll tell you a little bit about her and her component in FCI.
Hi, everyone. Thank you for having us. Super excited to share with you some of the information, some of the work that we've been doing for the last decade. As you heard, my training, my background is in nursing. I focus on cancer prevention, education, survivorship, and lead those programs, including a mobile clinic that we have for our firefighters where we offer annual physicals and referrals for cancer screenings. So a little bit about FCI, and I think we'll go into a little more detail, but we've been doing this. This is our 11th year that we've been funded by the state of Florida. And, it's to study cancer risk in the fire service. And our mission is to not only decrease the risk and mitigate those risks, but looking at it from a broader perspective and a holistic perspective. So not only looking at exposure data or screening, but really all of the things under the umbrella that put firefighters at risk. So our team is made up of scientists and experts from medicine, from public health sciences, from bioengineering, biochemistry, communications, education. And so really hearing from the firefighters and who've been at the table with us from the start, our partners, and sharing, and that's really how we got started in FCI, is firefighters came to us and said, there's a problem. We know our men and women are getting cancer at higher rates, but we need help. We need data to show, that this is a problem, that there's proof to it. And so really having them sit with us at every step of the research process has really helped us create very impactful research, but also research that is addressing firefighters' needs.
Start leading our conversation. I'm sure there's going to be some back and forth between everybody here and you guys as well. So we'll make sure everybody gets to interject and answer some of these questions. So, Captain, what do you have to start us off for conversation?
Okay. First, we're going to start with Firefighter Cancer Support Network. And what services do you offer after diagnosis, and what's the process that people go through?
So one of the challenges that many firefighters go through is who to turn to and who to speak to. One of our primary functions is to support that firefighter through their battle. We have a mentor program similar to a peer support group of over 250 firefighters across the nation, who most of which are cancer survivors themselves. And we partner them with that firefighter who has been diagnosed with cancer to answer the questions that can't be answered by anybody at the station level, at the shift, or even some of the physicians who have never gone through that process. So it's very accommodating. We have some of our firefighters, some of the firefighters that I've mentored over the time have become personal friends of mine. So we've enjoyed that discussion afterwards. We also offer that same process to their family members. Don't forget, the spouse is going through that same troubling times as that firefighter, as well as their children. So we offer that same support to their spouses as well as to their children.
Excellent. Excellent.
And you know, that's very important because we know we have a lot of firehouse physicians at the table, right? Just like we have a lot of firehouse
do.
attorneys and
Yes.
everything, right? So
Right.
having people that truly know the process to help them through that is extremely beneficial.
Yeah, absolutely. I mean, if a firefighter's going through treatment and has a side effect, who do you speak with? You know, look, with all respect to our physicians, you can't speak to them right away. So you can turn to that mentor and say, hey, did you experience that same process when you went through this treatment? Did you have that same side effects? If so, how did you battle through that? And that mentor could help them.
Now, Steve, what is the other, you were talking before the show, we were talking about the program you have in Northern Virginia with the relationship with the Cancer Center.
So a few years ago, we realized that one of the challenges was educating our physicians about firefighters and cancer. And they treated most of our firefighters like a regular cancer patient. But we're a little bit different. We're seeing cancer at a much younger rate, and our jobs dictate that if you're going through cancer treatment, most likely you can't work through that. So we first reached out to the Massey Cancer Center in Richmond and said, can we start this concierge service, bringing firefighters into the cancer center, having them assigned a nurse navigator within 24 hours to get through that process so they know that there's somebody there to assist them and provide that system. So that program in the Massey Cancer Center is probably about 3 or 4 years old, and it's working very, very well. The Inova Shaw Cancer Center in Falls Church is now signed on with us, as well as a few other hospitals throughout the country, with Memorial Sloan Kettering in New York. We also have Duke University and MD Anderson in Houston to provide that same service to our firefighters, to get them in, reduce that stress level that they have, because the first thing you think about is not only I have cancer, but I'm going to lose my job. Get them through that process, calm them down a little bit, and get them in for treatment.
And it's important knowledge too, right? We as career firefighters and Captain Cummins and myself, right, we deal with this and it's part of our job, and hopefully it's going to be covered with workers' compensation if this were to happen. I know we're kind of working backwards here, like, hey, if we have cancer, what's going to happen, right? We receive that diagnosis, but it's also important knowledge. A large contingent of volunteer members in our organization and nationwide, right, that this is not their full-time job, right, and they also have to keep supporting their family and everything else financially while they go through this. That's something they may have contracted being a volunteer. So it's just a whole nother dynamic that's important to navigate. And do you guys have, I guess it's a very diverse background of people in the Firefighter Cancer Support Network with varying backgrounds in the fire service, correct?
Oh, absolutely,
Yeah.
absolutely.
So there's going to be somebody that relates to whatever situation you're in.
Yeah, absolutely correct. We had a firefighter in Northern Virginia that went to Inova Shaw for thyroid cancer. The doctor said, well, sometime in your career, in your lifetime, you're exposed to some level of radiation that caused you cancer. He says, well, doc, slow down. I'm a firefighter. Well, it has nothing to do with it. We educated that doctor, provided him some research from our physician medical panel, and the doctor said, wow, you're right. Firefighters are different. We are going to treat them a little bit different, a little bit more aggressive to get them back on the streets faster.
Excellent. Excellent. Now, down in Miami, where we'd all like to be right now.
Yeah, what is the temperature?
So I know FCI, the Firefighter Cancer Initiative, you guys have an app that I've added to my phone, and it's a really interesting thing. Can you guys talk about things that you offer down there and what you're doing for the firefighters?
Sure, happy to. So yeah, you mentioned our app. It's the Firefighter Cancer Initiative Toolkit. It's free for anyone to download if you go to your app store and you type in FCI or Firefighter Cancer Initiative. And it has all of our resources. And again, this was something that came to us from firefighters. They said, you guys are doing all of these projects, all of these initiatives, but how do we keep track of them? It'd be so much easier if we had it, in the palm of our hand. So we've done that. So on our app, you have all of our active research projects that, if you're eligible to participate, contact information to say, my department's interested in your nutrition study, or our department's interested in having your clinic come to us. All of that information is there. All of our recent papers and publications are there. And then also all of our educational materials, so including our curriculum that you can download, and it could be independently run. Also, all of the education videos that we've created, the PDFs. We know that we are living in a digital world, so people are less likely to print something out and hand it out to members. So it's much easier to do it on your phone, take a quick snapshot, and text it over to your crew.
Fellows program?
The Fellows program is also on there, that we have some of our firefighters who are working with us as citizen scientists, where they are now being part of our education curriculum, that they're going out with our toolkit. So they've taken everything that's on that digital toolkit and made a physical toolkit, and now sitting, doing kitchen table talks, bringing up cancer prevention and screening in a more informal manner with someone, that's a peer. The other thing that's really important that's on there is our what to do at diagnosis. So we've built a pretty substantial survivorship program. We have a 10-week intervention for cognitive-based stress management. Our colleagues and very close collaborators at FCSN have been huge partners throughout this entire decade of work that we've been doing. And, you hit it right on the nose that, firefighters want to talk to other firefighters. And, that's what we've seen, and that's what we've done, a lot of peer support. The other thing is our navigation. We also have a FCI nurse navigator, and so is able to navigate anything for someone who needs any type of navigation here locally, but also in any of the other NCI-designated cancer centers. So as Dr. Caban mentioned early on, Sylvester is an NCI-designated cancer center. We're one of 73 NCI-designated cancer centers. So let's say, even if you don't live in Miami, but you live in Texas or you live in Alabama, we have connections and colleagues with other NCI-designated cancer centers that those relationships are already built, that we can connect them. And then the other thing that we have that we created as a resource is a health screening passport. So again, you mentioned some clinicians are not aware of the risks that firefighters have for cancer. And so they said, it'd be great if I went to the doctor and I can show them that I have a risk, that I'm not just making this up as a firefighter. And so we've created a PDF one-pager, one for men, one for women. On the front page, it gives some literature of how firefighters are at increased risk, and the cancers that there's a higher incidence of cancer in the fire service. And then on the back, it has the screening recommendations per body system and at what age they should be screened. So it's really a great resource. It's free, it's easy, and you can click and go, and then you have our contact information as well.
Steve, you had something you wanted to add?
Yeah, you mentioned about services, and our folks in Miami have provided the same thing. They call theirs a toolkit. We have a toolbox, and it's a Rubbermaid style banker's box that we provide that firefighter. And in that is a book that we've designed, and with the assistance of many outside resources, called the Firefighter Guide to Cancer Survivorship. And it provides resource materials for that firefighter from the date of diagnosis all the way through remission. And one of the things we have found in the fire service, we're very poor on creating medical documents for ourselves and wills for ourselves. And one of those things that this chapter talks about, the importance of that. Look, it might not be cancer. It could be the fire ground or running an incident on the interstate that can cause a fatality. Are our firefighters prepared for that? Do we have medical directives? Do we have power of attorneys? Do we have these wills? And now's the time to get that in order, not when you're diagnosed with cancer. So this booklet talks about the importance of getting that accomplished now.
Yeah, I mean, I'll say from a personal note, as far as like as our folks from Miami mentioned about the doctor, the physician education end of it. I mean, I know I went to, I'm okay with sharing. I went to a doctor at one point in time. I know plenty of friends that are same age or younger that have been diagnosed with cancer. Unfortunately, they're also firefighters. So I went to a urologist because I was concerned about something, and the doctor was kind of blowing it. I don't want to say blowing it off, but it was like, why are you worried about this, basically?
Right.
And I had to explain to them that, firefighters have 200% greater chance of testicular cancer than the general population. The doctor was like blown away by that. That a seasoned urologist had no idea about that, and I had to deliver that piece of information, and so to take it maybe a little bit more. I don't want to say seriously. I'm not like saying that they weren't going to take
Right.
it seriously, but it's a real thing. It definitely happens. So
And we have to educate the medical population of that.
Yeah.
Absolutely.
Absolutely. Okay, so let's get into a little bit of the science of this. So one thing that the IARC, the International Agency for Research on Cancer, they reclassified firefighting as a Group 1 human carcinogen in 2022. That was a change from the previous classification of a Group 2B in 2007. So can you guys kind of take that from like science to the streets, and what does that mean for us as firefighters, and boil it down for us so we can understand why we should be concerned about that?
Yeah, we're happy to share that. I was a member of the committee that did the evaluation for this reclassification. It's called a classification. So for our firefighters, what that means is that there's a world organization called WHO, World Health Organization. A sub-agency of that is IARC, the International Agency for Research on Cancer. One of the things that IARC dedicates itself to is producing monographs, which are great to read if you're having difficulty sleeping. You can pop one out. It's about 400 pages and learn everything you wanted to know about how a chemical gives cancer. So what's really interesting here with this monograph is that back in 2010, IARC took up the charge of reviewing the scientific and published literature to see if the profession of firefighting would give you higher risk for cancer. And so back in 2010, as the captain was saying, like at the time, those scientists read the literature and said, okay, it looks like there's a possibility that working as a firefighter could cause cancer. And the reason they called it possible is because there wasn't enough papers published and enough research there to give enough inclination. In that monograph, it was the same monograph where they also talked about shift work. So it was very interesting because they were highlighting nurses that engage in shift work and how they have an increased risk for breast cancer and other cancers because of shift work. And I'm like, our firefighters have the same thing. They do shift work, right, and are highlighting their exposures on there. So if you fast forward to 2022, it's been several years now, so a lot more new scientific papers are coming online that you can find. And so IARC puts again a new working group to review what was available. And the classification for cancer, whether something can cause cancer, is on 4 levels. It's a level 1, 2A, 2B, and 3. So in this new monograph, monograph number 132, after we read all the scientific literature, we had sufficient evidence to escalate and reclassify the profession of firefighting as a Group 1 carcinogen, specifically for mesothelioma and bladder cancer. We also saw elevated risk for other cancers like colorectal cancer, like Captain Talley was saying in his opening remarks in today's session. We also see prostate cancer, lymphoma are elevated. And so one of the concerns that we have is what can we do to prevent this in the fire service? That monograph gives us the scientific backing and evidence to say that we have literature from firefighters all around the world showing that there is an elevated risk for firefighting. And as more papers come online, that more researchers, hopefully like the future ones here in this room that are studying occupational health, they publish those papers, we know different strategies and different risk factors for these different types of cancers that we see in the fire service.
We have seen an increase in our cancer cases. If you guys could put up the case numbers over the last 6 years, we definitely have seen a significant bump in the last few years. And I think most concerning, we're halfway through this year and we've had 12 diagnoses and we've still got 6 months to go. So this is what's kind of started our desire to see what we can do to start getting ahead of this, to turn this trend in a different way. So, with that, is there anything that you guys are seeing in your research that's pointing to sources of this problem?
Yeah, so that's a $1 million question. Lots of
Yeah, I know.
Lots of point sources that can give risk for cancer, right? But we are finding different signals that we're happy to discuss and talk about today. The first is sort of the chemicals that firefighters encounter during fire response, right, and during training exercises. We know from different scientists, not just here in the U.S., but from around the world, that what is in a plume of smoke is really toxic. You have things that are like phthalates, like plastics. You have metals that are in there, especially with like EV fires that we see now more, electric vehicle fires arise. You have the traditional polycyclic aromatic hydrocarbons, the pHs of products of combustion that are present there. So when a fireman or a firewoman enter the fire scene, even though they're on SCBA, they're exposed to all these different chemicals in that environment. You guys know, because you'll see that soot, on your skin and on your gear from that exposure. So early on when we started this conversation today, we talked about the importance of sanitation and hygiene, making sure you clean the liners in your gear, you're sending out your gear for routine and regular cleaning between shifts, because we know that those chemicals that you're picking up on the scene can certainly impact that risk for cancer. It changes the biology and it makes us a little bit more riskier to it. So if this is your job and you're exposed daily to these different types of chemicals, we want to make sure that we're reducing that risk by taking good steps like preliminary exposure reduction when you're on scene and doing that. There are various chemicals that firefighters are exposed to there. One of the hot topics we're studying now are the PFAS or forever chemicals that we know are in gear of firefighters, are in the foam of firefighters. We are asked a lot by our Florida firefighters around plastics and looking at phthalates. So it really depends on different flame retardants. It really depends on the type of fire. Increasingly, we get more and more requests to understand wildland firefighting exposures and what happens during the wildland-urban interface and WUI firefighters. And most recently, we were working a lot on electric vehicle fires to understand if the plume of smoke is different from a combustion engine. So for researchers, there's a lot of opportunity there, but especially how we are informed is through our partnerships with our fire departments that tell us like, hey, please go out and study that. And that's what we do through the Firefighter Cancer initiative here, that you nominate to us what you need us to study, and we use our tools, both clinical and scientific, to be able to design the studies to evaluate those risks for cancer.
The other thing I wanted to add is, Dr. Caban mentioned wildland, and we're seeing more of those fires, but the other thing is we've been studying each of the subgroups very intensely now. We have several cohorts, one specifically looking at fire investigators and looking at their exposure. They're not, their PPE is not widely used as your structural firefighters. Also, the amount of time that they're spending in the incident during an investigation can range from 30 minutes to several hours. So there's definitely, we're looking at all the exposures, but we're also looking at the individual firefighter and what their tasks are and how that changes their risk. Down here in Florida, I'm sure everywhere, but we have those who are on the dive team. We have fire trainers who, are giving the instructions and teaching those who are in the fire academy, who are in, the burns every day. They're doing that on a daily basis, and people don't think, well, they're at the training unit, they're not seeing real fires, but they're actually seeing more fires than your typical structural firefighters. So, we're looking at different angles of not only exposure, but also the behaviors of the firefighters and how we can help them make change.
Of firefighters, when you're looking at what's going on, in our fire environment, are there any red flags that you see that, like behavior red flags for us that we need to work on changing in order to better protect ourselves?
That's an awesome question. I'm gonna jump in first on it because I'm excited about talking about when we're in an IDLH environment and we set up our hazmat zones like the red zone, yellow zone, and green zone. Sometimes incident commanders are in the yellow zone and not necessarily wearing the best PPE or using PPE because you're like, oh, I'm in an open, clear environment. But the reality is you are still exposed to carcinogen from that IDLH, even if it's a little bit further out. And we've done studies where we've empowered firefighters with, real sensor detectors while they're standing in the yellow zone and seeing that there are low and permissible levels of exposure. But if this is your career and you're going to do this over 30 years or 40 years, that low dose over time can accumulate and lead to cancer. This is why we strongly advocate for using PPE even when you're like working in the yellow zone and you don't feel you're in a direct hit, because long-term exposure of this adds up. The body has homeostatic mechanisms to protect us and try to counteract these carcinogens that we encounter. But if you have this as a profession where you're continuously exposed to it, we try to reduce that by using PPE. Even if it feels uncomfortable, it affects dexterity. It makes a huge difference to be on the right personal protective, even if you're working in, a yellow zone.
And I think the example is, are you talking about the Phoenix study with the PAH in the engine operators' urine
Tucson.
levels?
Yes, sir.
Tucson.
Yep. Yeah, in
Tucson, yeah.
Yeah.
Yeah, could you talk about that a little bit? I thought that was really fascinating. Never even thought of that.
Yeah, so this was by our colleagues, Dr. Jeff Burgess over at the University of Arizona. One of the ways to evaluate if a firefighter has been exposed to something is you can collect urine over time, right? So if you could get like a urine sample over multiple time points, you can see how much and to what extent that exposure has been. Right, so when you're on a fire scene, you can imagine once the firefighters are done, you know what their position was, right? Did you have entry? Were you outside? And you can collect those urine samples serially over a 24-hour to look at the levels of concentrations. And what you see in that study was looking at how there was higher levels of OH, a metabolite of the products that are in the plume of that smoke. The longer time or the deeper into the IDLH environment that firefighter went. So that was great scientific evidence showing a dose-response relationship. Like the closer and proximal you were to the fire, the longer time that you spent, the higher the concentrations of that toxic metabolite that was in the urine of the firefighter. So there's no question that is present and there's an exposure happening in those scenarios.
And to give an example of how change can be made, one of our local departments who had approached us asking this exact question, for our driver engineers who are standing out next to the truck in the, yellow zone, in the clear zone, are they being exposed? We did the test. Yes, they're being exposed. And so now they've implemented a policy. Now it's been, 5 years, but now their driver engineers wear a half mask when they're standing out there. And so it's a great way to use science and to see how it translates into change, on boots on the ground, having that policy change and really having leadership buy into seeing, what the firefighters are being exposed to and how it can impact their health, and really putting it in the forefront as a priority for the department.
Yeah, that's an SOP that was developed by the department, and they share it broadly. That's why I was saying for all of you listening to us today, if you have an idea and you want some data or evidence to show like are you exposed or non-exposed, reach out to us. We would be happy to collaborate. We fly to Maryland. We work with firefighters all around the country. The best scientific ideas come from you. You always tell us like, hey, how does this happen? And the reason is because it's translational. It's something that we can test, evaluate, or intervene on that is going to be practical for you to use in the fire scene or in different fire scenarios. It doesn't matter if you're a fire investigator, fire trainer, wildland urban interface, structural firefighting. You always have the most amazing ideas for us to help advance the practice of protecting firefighters from carcinogens.
Discussion about IDLH and what our firefighters are facing on the fire ground. And we're talking about the warm zone or the yellow zone. But let me throw this term out, EDLH, eventually dangerous to life and health. That's what we're seeing in the secondary smoke, the secondary exposures. Eventually, down the road, the exposure to these toxins are going to be great on our bodies. And we know it's the short-term incidents we run. Look, we don't mask up on food on the stove. We get it. I'm a realist. I understand that. But what are you exposed to? You're exposed to the pHs burning. The cabinets are not all wood. I mean, it's the plastics that are burning.
Non-stick pans.
Non-stick pans, correct.
PFAS.
PFAS all the time.
And I've seen companies that in our department that busy companies that go to fires in Montgomery County that on my shift, every time we run a food on the stove, I see them come out taking their face pieces off.
Exactly.
Because the officers have started doing that. And I've been the one to not do it for plenty of times in my career for food on the stove. And I've seen people start to do that because of this information and knowledge that they're getting from things like this.
Yeah. And it's the short-term exposure over a long period of time that causes this damage in our bodies. And we have to break that. And that goes into the slide, if we could put it up. We're not telling firefighters not to do their jobs. We're telling them to be aggressively smart. We want them to go in. We want them to use their training, their knowledge, put the fire out quickly. When you do that, you reduce the chances of exposure to these toxins. Do your job right. Wear full PPE throughout the incident. throughout overhaul, and I know that's not very well taken in most departments. But as we learned this in recruit school, that the worst part of the operation for exposures during overhaul, and we have to break that cycle.
Yeah. I think needs to resonate with everybody, and it's just, to me, that's the way I look at, like, I'm a safety officer, right? So it's like with risk in general, right? It's duration of exposure plays into it also. It's not how dangerous is this right this second? It's how long are we going to expose ourselves to this level of danger, whether it's we're on the side of the highway or anything like that. So I think that's a huge, really good point, right? We're not saying you're not going to do your job, right? It's, like you said, trying to minimize the duration of that exposure
Absolutely
is also
correct.
a big part of it.
Yeah, absolutely correct.
Yeah, and I think during overhaul, when we were at the Firefighter Cancer Support Network Conference in San Bernardino, someone had put up a slide about the off-gassing of the building for hours after the incident. There's 256 cancer-causing compounds being off-gassed. And so if we're in that environment, just slowly sucking that down, the negative effect over time, year after year, week in, week out, is going to be terrible.
And you can't see those toxins. They're atomized. And they're they're in the atmosphere that we're working in. And then they're on our turnout gear and our PPE. And if we don't come back and clean that off through preliminary exposure reduction on the fire ground, then come back and clean it professionally through an extractor or whatever service you have. And then take that shower within the hour. Get that stuff off. We don't want that stuff lingering on our bodies, on our PPE.
Is there any, I know you had a couple slides, Steve. Is there any of the other slides that you had that relate to what we're talking about right now that you want to show at this point? If that's okay, Gary.
Yeah, absolutely.
Yeah, I mean, we talked about the numbers. We know that, cancer is the leading cause of firefighter fatality, 80% of the union members. And this is really an interesting slide. It says 80% of the IAFF members that were memorialized out in Colorado Springs last year died of cancer. We're missing an important factor here. That's 80% of the career firefighters. We have no clue, we have no data, we have no research on the volunteers in this nation. And they make up 2/3 of the firefighters. We do not know the true issue of cancer in the fire service because we're missing that cohort. We're missing those folks, and it's terrible. I keep some records in Virginia, and Gary had some specifically from Montgomery County, and I started keeping data since 2019, and folks have reached out to me. We've had 313 firefighters diagnosed with cancer, and then 46 deaths. And as we were sitting here, I got paged. The number's now 47 in Virginia. We just lost another firefighter this morning to occupational cancer. So, I mean, the data's there. And it's so important to collect data. I mean, let's face it, we can't make legislative changes. We can't make changes within our own department unless we have that data. So data collection is imperative. Dr. Grace LeMasters did a study on occupational cancer as to what we're exposed to, and you can see here some examples. We talked about food on the stove, the typical auto fire, and the doctor mentioned, it's not our typical fire anymore. It's what's off-gassing an EV, but don't just think about EV. Those same batteries at a smaller level are in our cell phones and the computers that are burning. So again, we go in, the computer is smoking, we just pick it up and we're being exposed to that. And over time,
every fire we go to, regardless of what the point of origin was, it's probably going to involve something
exactly.
involving a lithium battery.
Exactly. So, I mean, it's truly important. And our discussion about firefighting, we've learned what flow path is. We understand the pattern of fire and smoke and heat throughout structure. Now we're going to take it one more step. Let's talk about exposure pathways. We're exposed to fire on the incident scene. It's absorbed in our PPE in our bodies, and then we leave the scene. I know a lot of departments have made policy that you don't go into rehab unless you go through preliminary exposure reduction. Why are we contaminating the area we're treating firefighters or victims? We don't want to drag that in the back of an ambulance or a medic unit. So again, the importance of preliminary exposure reduction, and the studies are there. I mean, we know just by using soap and water on the incident scene through preliminary exposure reduction drops 85%.
And for people who don't understand, the preliminary exposure reduction is just a terminology change, basically, from what we're referring to as post-fire decon, right? Because that's how we have termed it thus far as we've been evolving and initiating some of these things. So.
Correct. The NFPA wanted that changed to make sure we don't confuse that with hazmat decon.
Gotcha.
we just collaborated with NIOSH, and they provided this infographic for us, and it's available on our website, and we'd be more than glad to share it. It just talks about contamination and then how to reduce that contamination on the incident scene. It's very simple steps. Wash, get out of the gear, bring it back to the station, professionally clean it, and then clean yourself.
Good stuff.
It's very important stuff.
Yeah.
And then, so we can, and I guess the other thing for our doctors in Miami, since you're studying this stuff, the departments that are doing these things, are you seeing a reduction in their cancer rates?
Yeah, that's a difficult question to answer because cancer takes such a long time to develop that even if a department, has been working for 5 to 10 years, to see a change in the rate of cancer will take a little bit of time. There are some techniques you can do to look at it, but we're doing a little bit now with some things called epigenetics to see if a certain practice of decontamination actually changes the biology. So before you even get cancer, to see if those are impactful, and those studies are ongoing. But I do want to emphasize the point that Steve made about sort of that decon early on, because if that decon doesn't happen, you transfer everything that you got from the fire scene back to the truck and back to the station. So even in the station, there's going to be exposure for carcinogens because they're still free floating all the way around in those spaces, right? One of the beautiful stations that we've gone to over the years has been in Des Moines, Iowa, who invested heavily on the redesign of their station, right? When we talk about how you can prevent cancer in the fire service, we can think about how we can organize the fire station, where the rooms are located, what are the HVAC units, how is there a separate room to maintain the gear and clean the gear that's separate from an HVAC system where you're sleeping, in order to be able to reduce that carcinogenic spread. Because we've done studies, for example, where we swab different areas of a fire station. Our colleagues up at the Harvard School of Public Health, Emily Spare, had done a study looking at just taking a basic textile, wiping the different areas of your bunk and of the kitchen and of the bay, and found particulate there, right? And how did it get there? There's not a fire in the fire station. It's the transfer that comes back. So we can't emphasize enough the importance of doing decontamination procedures on scene as much as possible. I realize sometimes it's freezing outside, right? So if you can at least wipe, and put the gear in a separate compartment and put it in a bag, whatever you can do to sort of minimize that transfer. We have a video that we're happy to share with you all in the future. That's about 4 minutes showing using invisible dye, like the dye that's used for counterfeit money, of how toxins that are picked up at the fire scene transfer back to the station and even all the way back to your family, speaking about your spouse and your kids. So if you want to avoid that transfer of carcinogen, not just at the fire scene, make sure you do that decon. It's really important.
And this is part of what we've been doing as far as our education curriculum, is sharing these tools and tips with firefighters on, making sure they keep their, work t-shirt and pants and washing that at the station, not bringing that home and putting in the same wash with your, family and kids' clothes. The other thing, Steve, that you mentioned, I thought was a really important part, is keeping that that area, the decon area, away from your rehab area. So many times we talk about that where they're not deconning, and then they take off their glove, they grab a granola bar, and now everything, all the carcinogens that are on their hand, they're now ingesting into their body. So really making sure that there's that separate piece. The other thing is, I loved your slide about getting out as quick as possible of the gear, doing, putting the fire out, but not being in your gear. I've seen a lot of change now with practices, but when we started, we would see the firefighters with their hoods just hanging around their necks. No fire around, but they were just hanging around their necks, and we're seeing it here. The other thing that we really try to emphasize is, wearing your PPE when it's needed, not wearing it to exercise or to do a 5K or a stair climb, like not exposing yourself when it's not needed. So little tidbits like that we try to share, and giving the firefighters these tools to reduce their risk, not only at work, at the organizational level, but also giving them modifiable risk factors. So we talk a lot about diet, exercise, sleep when they can, stress management. So all these things that all play a role in their cancer risk.
I can go to many firehouses and watch firefighters working out in their PPE. And what are they doing? They're reintroducing those toxins in their body. There are companies out there that are producing PPE with the weight and the structure of the gear that are made for non-structural use. So get out of your PPE, don't use it, don't work out in it. Find some weighted vests to simulate wearing the gear, but do not, please.
Yeah, I mean, all this science is so dynamic, right? There's so many factors at play. We're talking about like the sleep that the doctors just mentioned. I mean, there's so much that's involved as a potential contributing factor. But like you said, like we don't want people not to work out. Obviously, it's great. Job-related fitness is great, right, for cardiovascular health and even for cancer prevention, right? In general, just being physically fit. But something like that, while you may be doing something good to benefit yourself, it also might end up being a net negative depending on what the science eventually finds. So
There's many alternatives.
yeah.
Yeah.
So just a quick time check. We're about an hour in. Great conversation. It's flown by already. I do have a couple questions that have come up.
Okay.
So I don't know. Some of them I think might be items that we're going to address. And so I'm not necessarily going to address them in order, but I do want to hit one real quick because it's something we already talked about. And I don't want to mention or forget to come back to it. It was a question regarding education, like the education aspect. We talked about physician education, education for firefighters, things like that. I guess this question would be for everyone. The question was, we know of stories where there's pushback from local government or workers' comp agencies on covering firefighters diagnosed with cancer. Outside of the blunt data, are there outreach programs for local governments or workers' compensation companies, like similar to the packages I guess you were talking about with for physicians for the firefighters diagnosed, things like that?
It goes back to educating our physicians and meeting with them. The Firefighter Cancer Support Network, we have a medical review board. They looked at about 18 of the most, I don't use the words popular cancers, most diagnosed cancers, and they provided a research document on each one of those, and it speaks, as we mentioned earlier, from our research physicians to a doctor. So we have them on all levels of types of cancers, and we provide that to that firefighter to bring to their physician to educate them. We've also reached out, at least in the Northern Virginia area, to meet with the physicians and educate them at their level. So right now, there's nothing else out there. Maybe in Miami, they are doing something a little bit different, but that is a hard challenge to get the doctors to sit collectively in one area for a length of time to discuss it. It's a challenge.
All right. So I have a couple other ones also, but we can either get to those now, or if you want to continue on and see if they come up.
Yeah, let's hit 'em.
Bring up
Okay.
a question.
So I think one was already answered. It related to PPE and engine drivers, specifically like people in that warm zone or that yellow zone that we talked about. And there's all different things. So certain departments have policies, but I think they addressed that, at least hit on it. The next question was, is there any insight, this will probably be to the physicians, any insight regarding newly diagnosed autoimmune disease or immune dysfunction that could be precursor or warning signs of possible development into cancer?
Defer that to Miami.
No, you start first. You start first. Just kidding. I'm kidding. All right. So there are studies underway that are looking at immune response when firefighters are exposed to fire. Like even here in Miami, we just finished doing a study we called Thermal, where we were evaluating immune system response from firefighters undergoing training exercise. We love training exercises because they're like great little experiments. You know, everyone's doing one specific thing, everyone's exposed to the same thing during the same amount of time. So it makes it really helpful for us to be able to look at how the immune system responds to them. We call them interleukins, so you'll hear the term like interleukin 6 or 13, and we can measure them in the firefighter body to see how the immune system responds to an immediate insult to fire, right? So if you're in an IDLH for 15, 20 minutes, what does that immune function look like before and after? We also did that for the electric vehicle fire. The challenge with the studies we have right now is that they're short term. They only give you a sense of what's happening to the immune function immediately from that fire exposure. We have ongoing cohorts that we're following firefighters for a long time, where we're doing repeated measures and getting blood year after year, so we can see how the immune system changes from repeated bouts of exposure. We're also doing that, by the way, with inflammation, because there's a lot of discussion not just about immune system response, but also inflammation. when the monograph came out that we talked about in 2022, looking at cancer in the fire service, we actually put into the monograph when we were writing it that we are seeing a signal of increased chronic inflammation in the fire service from exposure to fire. We need more studies. That's why Steve said it, like, please participate in research when you can. It makes a huge difference because then we get specific data about firefighters and what happens when you're exposed to them, especially in the long term. So right now, there's not evidence to say that as a firefighter, you're at a higher risk for autoimmune diseases, but we certainly are seeing changes in immune function and response based on your attendance at a fire scene.
Did one of your studies on retired firefighters, which was very enlightening for me, and I would highly recommend that we bring that to all retirees to get on to the FCI website and join that study on retirees, because we're forgetting about them. You retire, you're gone. But again, we know, when that exposure occurs, how long before that cancer is diagnosed. And most of the time, our retirees are,
Yeah.
Yeah, they're gone.
yeah, well, I hate using the word gone.
Well, they've moved
but
on
they
to
moved
better
away,
places.
right?
Yeah.
Exactly.
Yeah.
All right, no, that's
Right.
excellent. Thank you guys for that answer. I think that summed it up very well. The only other question I don't think's been addressed yet is related to saunas, and I know that was something as far as like possible preventative measures or things. So I think we'll get to that probably in a
Yeah,
second. but
no,
that's all
actually,
I have for right now.
I was going to get to that.
Okay.
I'm reading a lot about post-fire decon soaps and then also saunas. And some fire departments are spending a lot of money on saunas. I was wondering if you guys could comment on them and what, you think about them. And should we be spending extra money on special soaps or just using a, bar of Dove or whatever?
Yeah, thank you for that great question. I'll tell you what I know. We are a very small world of like scientists and clinicians that work in the space of firefighter health and safety. We care a lot about our firefighters and talk to each other to make sure that the messaging that we try to do as scientists and as clinicians is consistent. To my knowledge, there's only one study on saunas in the fire service, which came from Jeff Burgess at the University of Arizona. It was a very, very small study looking at infrared sauna. As you know, there's many different types of saunas, right? Wet, dry saunas, infrared. The challenge that we have right now with making broad-based recommendations to the fire services, we only have one study with, I think it was like 12 or
Yeah,
or
less than
20
20.
firefighters. It's very small to make any recommendations. Why? The reason is because firefighters are exposed to so many different types of chemicals that it is possible that a certain type of sauna exposure, whether wet or dry, might actually accelerate the absorption of a toxin versus try to get rid of it from the body, right? And because we don't have enough data to show if it's good or if it's bad, we are unequivocal, right? We don't have necessarily a recommendation like, yeah, for sure, every time you come out of a fire, jump into there, because I have no idea what was in the fire you were in. Was it agave plants that were on fire? Was it cinder blocks? Was it a kitchen fire where cookware was there and there was PFAS free floating high? I don't know. So I don't know if I tell you, go into a wet sauna or a dry sauna to try to detox after a fire, and how often, how immediately after and for how long. The science is still out to be there, so we have to do that on the sauna. On your other point, Cap, about the wipes, people have to investigate. There's not a universal wipe that whatever you use to wipe with takes every possible toxin that you come across. I strongly believe that you should do some sort of decon. Steve said this earlier. There's the NIOSH study showing that regular soap and water, like Dawn soap and water, reduces 84% of the polycyclic aromatic hydrocarbons that you encounter. So the faster you can get soot off of you, the better, right? So do decontamination immediately, on scene, wipe. I don't care, whatever, wipe. There's many brands out there that does it. I think whatever you can do to clean yourself, regular soap and water, is good. The science will catch up. It just takes us a while to evaluate and determine, how effective, what type of chemicals come off of it. But the faster you can get out of a scenario where you have carcinogens, the better.
So it is. Come back to the firehouse, take a shower, good workout. Let's
Yeah.
face it,
Right.
you're getting your
Yeah.
body systems back up to fight those toxins.
Yep.
All right.
Do you have any other questions?
I have one, but I got to ask it real quick. I think I know the answer to it just because I think it's kind of a whole other set of research in itself. But it just came in. If you've noticed a change or any correlation with firefighters diagnosed with cancer and the COVID vaccines, again, I think that's kind of a whole separate set of research into that. But do you guys have anything on that? It could be a simple answer, but.
Yeah, no, there's no evidence, at least that we've seen, and from the firefighter literature showing that firefighters who vaccinated with COVID had a higher risk. We haven't seen that.
Okay, thank you. Gary, what else you got?
Okay. To talk about cancer screenings and the importance of early detection, we started a couple years ago. The union brought in UDS and started doing screens, and our first run through was pretty shocking. I think we found 6 cases of thyroid cancer that were all asymptomatic at the time, and they've continued to, we've continued to do those. We've added the Grail test. Could you guys kind of comment on them and what you guys are seeing in them, and kind of dispel any myths or fear about getting them? We've got some people that are kind of hesitant to get them, and so if you'd comment on them.
Yeah, let me talk about thyroid cancer in the fire service, and then I'm going to pass the baton over to Dr. Solle so she can talk about screening, because what we try to do is inform clinical guidelines to the conversation we've been having, right? Like, so we can teach healthcare providers about why firefighters are at unique risk, and we want to do screening early. Literature from around the world, here in the United States, and even our Florida firefighters show an elevated risk of thyroid cancer in the fire service. And that's largely due, we believe, to shift work, right? Sleeping, because when you are supposed to be sleeping, you're awake, and when you're awake and you need to be sleeping, that causes a lot of endocrine disruption. I always say it's like driving, a stick shift car in a busy city street. It's not fun, right? You want to like room and around it. So the thyroid is always in different shift work is secreting hormones and not secreting hormones, and over time that can cause certain changes to the thyroid that can lead to cancer. The other one is the chemicals that you're exposed to. Dr. Solle was mentioning earlier, we see firefighters that leave their hood on all the time. If your hood is contaminated, some of the chemicals that we have, like certain flame retardants, have mimicry. They look similar to the thyroid hormone. So there could be some confusion where the thyroid tissue picks up the chemicals that you got from the fire scene and tries to incorporate it into the thyroid. And so over time it can, cause cancer. So we do see thyroid cancer elevated in the fire service. We want to make sure that firefighters are aware that they shouldn't be wearing anything gear. Their neck should be clean, because the thyroid sits right very close to the outside of our neck and can have those exposures. And the importance of maintaining good sleep hygiene. Not only when you're on shift, I realize that's out of your control because you got alarm bells all the time and you got to wake up. But also when you're off during your 48 hours off, make sure you're getting the right rest and sleep so that you don't have issues with the thyroid. Now let's talk about screening.
Yeah, so for our screening, as I mentioned, we have our mobile clinic, and we follow American Cancer Society as well as U.S. Preventive Task Force recommendations and NFPA recommendations. And so with that, we do follow, gold standard evidence-based practice. So we order labs on your thyroid panel. We do a pretty extensive, not your typical just TSH, T3, but we do a pretty extensive thyroid panel because we know the increased risk for our firefighters. And then from there, if we see something abnormal, then we'll order an ultrasound. So it's really, in the medical world, we're not just ultrasounding for screening, we ultrasound for diagnosis. So it's only if we see something abnormal. I know you mentioned that there were a lot of things that came up for your department on scans for the thyroid, and it's really common. It is common that you see nodules of different sizes, and so a lot of times what you'll end up getting is false positives, which create a lot of stress and anxiety for the firefighters when it ends up being, nothing that they need to worry about. So that's why we make sure we run those labs ahead of time. And then, because if you do have a nodule, you have something that's abnormal, your labs will show it. And so that's, the approach that we've been taking. We do that with all of our screenings. We run very sensitive blood markers and biomarkers, and if we see an abnormality there, then we refer for follow-up, because we don't want to just be, scanning every organ in the body and causing more stress on the firefighter.
And I learned going through it, when to remind people, hey, this is just the early stage. You've got to follow up with your doctor, because there's that fear of knowing, so people don't want to go. And it's like, no, go as soon as you can, because it could be nothing. And and we have some people now that are kind of in surveillance mode, and that's happened with guys with their PSA on their prostate, and it's good they know. So
Yeah,
I mean,
and
the
the
goal-
other thing that we've been able to change through, policy change down here, because of the data that we see in the higher incidence of certain cancers, we're having firefighters be screened at a much earlier age. So, general population colonoscopy is 50, where we can get our firefighters a colonoscopy at age 40. And it's similar to as if they had a family history because of their risk, because of their occupation. So again, that goes more into educating clinicians about this is why this worker group is more at risk. They should be screening early. Same thing with making sure that our firefighters are going to a dermatologist and getting a full skin exam. And just educating. They don't realize that they're on the side of the highway at a call and sitting in the sun for 6 hours with nothing on because they're working, and they don't realize that the sun is hitting them. The other thing we've shown and published on it, not only the increased incidence of melanoma in our Florida firefighters, much earlier age at diagnosis, so 46 rather than the general population of 63, and then also the anatomical position of the melanomas that we're seeing. We're seeing it really right in line where the mask sits of the firefighter. So really important, again, to make sure they're wiping off those masks. And one of our local departments, they just got this new machine. It looks like a dishwasher, but they put all of their mask and their all of their SCBA in there, which is really a game changer for them. So it's something that I think more people will probably start seeing in other ways, because that's you mentioned it early on how it's hard to clean that area. So try and make it as automatic as possible for the firefighters.
Yeah, I just
so you
want
talk about. Oh, go ahead, doctor.
No, just one last point, because it's really important. It's one of my favorite points to make. When you go to the doctor, if you go to the doctor, please go to the doctor. But when you go, ask them to do a full skin exam, right? And that doesn't mean like just look at the arm and be like, no, they do a full body head to toe exam of a firefighter. You should do that every year, once a year. And any of the particular moles or anything that looks uncharacteristic, the doctor will refer you to dermatologists. And it's part of your annual physical exam. Get your head, from skin to toe checked. And the reason I'm passionate about it is because skin cancer is elevated in the fire service compared to the general population. Dr. Solle was mentioning how it's diagnosed earlier within firefighters than the general population, and it's because you're exposed to soot. That soot stays, stuck on your skin, and it's like marinating like a chicken with seasoning, right? So we don't want that. So one thing you can actively do as a firefighter is when you're in there for your physical exam, be like, oh, by the way, doc, can you give me a head-to-toe skin exam? And they do their ABCDs for skin checks. I think that's really important and something very easy you can do on your own.
One of the initiatives that we brought in Virginia, we were working with the Virginia Dermatology Association. And a lot of their dermatologists are providing time for us, and they're doing these checks free of charge at the firehouse.
Oh.
So they're coming in, it takes 15, 20 minutes per firefighter. They're doing it for free. We're knocking out 30, 40 firefighters a day.
Yeah, I mean, I know this is something recently that came to the forefront of my mind because I have a couple friends in the department that had issues with skin cancer.
Yeah.
And it's something I never thought of. I know of all the other ones, and I was like, it never occurred to me. And now it's like, wow, I need to go.
Yeah, and you talk about the anatomical position. We're seeing it right in the center of the back, right where your SCBA harness sits, like, mid upper back. I've had quite a few of those cases. And I don't have the numbers off the top of my head, but we have a good amount of skin cancer in the department. So We are seeing it.
And again, go along with the apprehension for being checked, right? I know I was always, and I'm obviously not very old, right? I was always in the mindset, especially before I had kids and a full family, like I'd rather not know kind of thing. Like if something hurt or felt weird or whatever, like I'm not going to the doctor, I'll get better, right? But now I'm like, started thinking about like, it's not about me. You know, there's other
Right.
people that are relying on me being well, so.
We got to get over that stigma.
Yeah, it's.
I
yeah.
mean, here's
It's real though, it exists.
It is.
It
Yeah.
existed for me, I know, and I started thinking differently.
Here's a basic statement. Early detection saves lives. It's that simple. If you feel, we talked about detect together in the 2-week rule. If you're not feeling well or you have a pain or an ache, don't linger. Go get it checked. I mean, it's that simple. Get over it.
I had a note here, right? You know, the fact that cancer is not a death sentence, right? Especially when we
It's
do
not.
this stuff, and that's what you're all about. We have this in the fire service, this survival mindset, right? We talk about it, and we do safety and survival as it relates to your survival on the fire ground. You know, the go down swinging mentality, never give up, right? Well, it kind of goes along with all this too, right? It's all about, and mindset's a huge, you know, part of medicine, right? It's part of it, plays into it, the psyche, the whole. It's a whole other conversation, right? The psychological aspect of it, but maintaining that positive attitude, having these support networks, getting checked early, so we can, you know, get this treated.
Look, we work too hard on our job. We spend many hours at our job, and we work for 20, 25 years. You know, we worked hard. Now it's time to enjoy retirement, and we want to go into retirement healthy, so we can
Absolutely.
enjoy the fruits of our work.
Yeah, and it's, I mean, in my work, it's heartbreaking to get somebody who comes in and they say, yeah, I've been feeling this for 8 months, 12 months, I've been ignoring it, and now they're stage 4, and you know they're behind the 8 ball, and it's terrible. And I've had other people that have gotten the UDS screen, they found something, they found thyroid cancer, it was really early, stage 1. Went in, had a procedure. Within 4 to 6 weeks, they're back to full duty. You know,
awesome.
and it's not a long-term, you know, problem. And you know, I think the other thing is, it's kind of the responsibility we have to our families. You know, we've chosen a very dangerous profession, and it's only fair to our families that we take it seriously to be in the best health that we can be in. And you know, we have enough information out here now that we should be taking advantage and doing the things we're supposed to be doing to protect ourselves, to be there for the long term, you know?
Absolutely.
I remember somebody telling me when I was first diagnosed the importance of early detection. You don't want to have somebody else walk your daughter down the aisle and not be there for her. So very important about early detection.
And I
Absolutely.
just wanted to add, you know, we're talking about prevention and early screening. Really important with your men and women, make sure that they have a primary care provider.
Yes.
I tell you, majority or not all of the firefighters we talk to that are under 30, they're young, they're healthy, they don't have a primary care provider. Why do I need to go to a doctor? Or they say, well, I went to the physical with the department. So they don't have anyone to go to. So making sure that they've got somewhere set up where they're actually not going to an urgent care every time that they've got something, or they say, well, I don't have a doctor, I'm just going to put it off. So somewhere they can go. It's something people
Yeah,
really realize.
Really relatable to us. If you come in for your annual physical and the doctor at Fromm's finds something and refers you to a doctor, and usually it's your primary care to start, if you don't have that doctor, it could be 8 to 12 weeks before you can get in. And you know, we've had situations where the doctor's like, hey, this person can't work right now because of this situation. They don't have a primary care physician.
Right.
Now their care, you know, getting better and getting it treated is delayed. So it's really critical that you have a primary care physician.
Another excellent point. We're about 10 minutes left. I want to give everybody time to give, you know, some closing remarks if they have anything. I do have one other question that came in that I guess we'll hit, and then we'll go around if you're good with that.
Excellent.
And if anything else, we'll give, you know, in your closing remarks. So the last question that we're going to get to, and I'll go over how to address any further questions that people have if they are watching this later. And this is most likely to the physicians down in Miami. Have there been any conversations or beginning stages of research isolating shift schedules? So, for example, 24/48 versus a 24/72 on the cancer risk and how that plays into it, or are there departments who have moved to different schedules reported changes?
You all can't see the room, but our students in here are laughing because we were talking about this earlier today about fire department's interest in data about shift change. There are, I think, 4 studies published in the scientific literature looking at shift change. They have different outcomes, like what they were looking at with the shift change. We are going to be working with a fire department here in Florida that is going to be going from a 24/48 to 24/72 shift in January of 2027. And we'll be collecting data with them now in the year 2026 so we can get baseline data. We're going to be looking at a couple of different outcomes there. Obviously injuries, to see if injuries reduced the quality of life and sleep of those firefighters, and also family relationships. They were very interested in knowing if family relationships are improved by changing into a 24/72 shift. We always believe that there's many things you can change in your environment to, ultimately improve, cancer reduction, right? And to reduce the risk for the development of cancer. It is very possible that shift change can do that. We don't have a lot of data at this very moment to substantiate what those rosters should look like, should 24/48, 24/72 or other system. But we're excited to do that research because, using wearables so we can monitor, different aspects of what a firefighter goes through, and collecting biological samples will really help us inform what happens when a department elects to do that change. Because as you all know, there's financial repercussions with, the cost of hiring more men and women to support that staffing change, and also just the logistics and behavioral. But from a scientific perspective, does it improve firefighter health, safety, and well-being? So far, the jury's out on that, but we're excited to do that research.
So the person who asked that is actually our department athletic trainer, and she's going to be very, very interested in the results of that and hearing what you have to say. And a lot of the people watching this are very passionate about that topic
It's
as well.
a hot topic on social media.
Yeah, we'll all be anxiously awaiting that research. So thank you for that. So again, we only have a few minutes left. I'll let everyone go around the table and just any closing remarks or things you have. So for our folks in Miami, I'll let you guys go first.
Yeah, so let me just say I'm thankful to the Montgomery County Fire Department for this privilege to be with you today and have this conversation. It's the start of a new year, right? It's 2026. So what a better way, and I'm thankful to IFF for recognizing this month as Firefighter Cancer Awareness Month, to say let's have a conversation of what you can do, what's in your power as a firefighter, for your peers there at the fire station that you can do. So choose one thing and try to focus on that 1% that you can do of change immediately in this new year to help you with the fire service. Please know you're not alone. We're here. You have the Firefighter Cancer Support Network. You have us here at Sylvester Firefighter Cancer Initiative. We love taking questions. 305-243-FIRE. We will help you navigate. It doesn't matter if you're in Maryland, Oregon, California, or in Key West. We will help you navigate to find the right resources that you need to help the conversation of cancer prevention and the fire service move forward.
Thank you guys very much. Again, I can't thank you enough, you and the class, for joining us today. It was really great to have you get your perspective. So it was awesome. Thank you again. Steve, what do you have for us?
Once again, thank you, Captain. Too many captains. For having me here and having this truly crucial discussion about cancer in the fire service. It's terribly important. We mentioned it's Firefighter Cancer Awareness Month. So go on our website, firefightercancersupport.org, download all the free material, utilize it. There's many stories, survivor stories in there. And I'll leave you with a couple points. First and foremost, don't think it can't happen to you. I was diagnosed 9 years ago. I was probably in the best shape condition physically and mentally. And when I went for my annual physical, my doctor came back and said, hey, we found cancer. So it could happen to every firefighter. Second point, if you don't make time for your wellness, you'll be forced to make time for your illness. Eat healthy, PPE, make sure you clean it. On-scene decon, preliminary exposure reduction. Make sure you take those steps to make sure you're well. And then finally, the last words you want to hear from your physician, hey, if we only could have quoted earlier, early detection saves lives. Do the right things so we have the ability to enjoy retirement.
Awesome. Well, again, thank you again for joining us and for everything you and the organization does for the fire service. Cap?
So I want to thank you guys. I really appreciate it. I'm really happy that this discussion has started to happen, and I got to thank the fire chief. He's made it a really important priority for us. I'm going to throw it out to the people in Miami. You've got grad students there. We have a large population of career and volunteer firefighters of all ages. And, we want to help the science advance. So, we have over a couple thousand members to help with studies. So I want to throw that out to you and, look forward to building a relationship in the future and also with Firefighter Cancer Support Network. We have a lot of survivors and that are looking for stuff to do, so possibly they could become peer mentors. Absolutely. And look at bringing your training to the department to better get ahead of this. So thanks again. We really appreciate it. It's been great.
Absolutely. And so just my closing remarks, I guess. I don't know if I would have thought that leading into it, but I think this has probably been my favorite episode of all the ones we've done so far as I think the impact, the information. I think part of that is having a remote panel, which wouldn't have been possible without the efforts of the 1075 Media Group, which I have to plug, but they got this whole thing together to be able to effectively and I think very seamlessly teleconference them in. So their efforts are awesome. For everybody who is watching, please advocate for people who were not on other shifts at your stations or whatever as they come in over the next 2 days to go back and watch the episode because I think it's very impactful and important information that everybody should have. So again, one last thank you to the panel. This was a great discussion. And just the only other wrap-up thing would be our any lingering questions that you might have if you're watching it later or you just didn't get to ask them or they didn't get answered in the time we had today. Email them to myself or Captain Cummings, and we'll make sure that they get to the appropriate person, whether it's the folks down in Miami, Steve, to get you the answers or the information that you need. Anything that was mentioned as far as like informational packets, phone numbers, anything like that, we'll make sure that that's available to anyone who needs it. Our next episode will be coming up on January 26th. It'll be a Boss Talk episode. We'll get back to some fire-related topics as far as fires in parking garages, some tactical considerations, and a case study for a fire that we had down in Bethesda on St. Emil Avenue a month or so ago. So until next time, again, thank you everyone for joining us and have a great rest of your day.